What's a patient-centered thing? Right now, there is something called a health savings account. A health savings account, if your policy costs you $15,000 a year for a family of 4, and I met with a group of women, business women today, and one of them said, my family of 4, it's $15,000. Well, you would take, instead of paying all that money to the insurance company, you would take a portion of that money and put it into a savings account. That money's yours. You can only spend it on health care, but if at the end of the year you haven't spent it, you can save it for the next year. It rolls over, if you will. And as it turns out, and you'd have a wraparound policy, so if your child gets leukemia, you would have a policy on top of that that would pay for everything. That would pay for everything so you would not go bankrupt, because we don't want folks to go bankrupt. Now, this changes things, because all of a sudden, instead of somebody, so I'm sitting with these business women today, and one of the women says, I've got a great policy. I never look at the cost of things. And she says, I just get the name brand everything. She's a really smart woman, but she's got no incentive to do it. But contrast that, I had a town hall down in Ascension Parish, and this fellow had a health savings account. So it's his money now. It's not the insurance company's money. And if he doesn't spend it at the end of the year, he gets to keep it. And it goes into the next year to help pay for care for his children. And he goes, man, I'm a doc, so if I start talking like a doctor, I apologize. But he goes, yeah, I was cut from here to there. Now, I can tell you, your scalp bleeds. If anybody's ever had you just gush. And so I cut from here to here. And I just put a towel on it, and I started calling people saying, where's the cheapest place to get it fixed? And somebody said, go to St. Elizabeth. Well, what's the cheapest you can do it for? And they said, we can put the glue in there and fix it for $160. He goes, put the glue. And he says, it's going to burn. He goes, I don't care. And he goes, Doc, it burned, and I didn't care. And because he was spending his own money, and at the end of the year, if he didn't spend it, there was that much more money he could roll over and therefore save instead of making another contribution. He was motivated to do it. Another person, I'm mentioning this to someone, and he said, I have an HSA. My doctor wrote me a prescription for something that cost $159. I knew that because I had previously gotten it filled. Now, remember, he didn't say 160. He said 159. And he said, I told my doc, I have an HSA. Can you give me something cheaper? And the doc said, oh, you got an HSA. He tears it up and he writes me a generic. It's $20. He just saved the system $139 because it's his money he's spending. Now, he would have spent it anyway on insurance, but instead he put it into an account, and that account is now his. It changes how we look at things. As it turns out, these sorts of accounts, HSA with the health insurance policy wrapped around, according to the Kaiser Family Foundation, they're 30% cheaper than a traditional insurance policy with similar benefits. 30% cheaper. And that's because all of a sudden you are empowered to make the best decision for your financial health. Now that's important because our goals of healthcare reform, we said them at the beginning. High quality care, accessible to all at an affordable cost. If you lower the cost of an insurance policy 30%, people who couldn't afford insurance suddenly can. So according to the Kaiser Family Foundation, 27% of people with HSAs were previously uninsured. Now they can afford it, so now they buy it. About 40 to 50% of them have family incomes of $50,000 or less. 60% have family incomes of $70,000 or less. So these are middle-income people who have found that this is a way that they can now afford insurance. But it changes things because when you're spending your own money, you may be a little bit more conscious. Not just the guy from Ascension pulling the towel off of his head. Doesn't it sound like a horror movie, like Freddy's back? But John Fleming is a congressman from Shreveport, a family practitioner, and also a businessman. They went to an HSA. And one of his workers said, well, you know, I'm spending my whole HSA on inhalers. And Fleming looks at her and says, well, if you stopped smoking, you wouldn't need an inhaler. And she looks at him, she goes, really? He goes, yeah. She stopped smoking. She wanted to save the money on inhalers. So not only are we saving money, but she's also healthier. And so as someone moves to a healthier lifestyle, we also save dollars. That leads me to my last example of what a patient-centered healthcare system is. Safeway is a huge grocery store chain across the nation. They're not in Louisiana, but there are many other places. And they wanted to save money, so they lower the premiums for people, their employees, who participate in wellness programs. They don't raise them if you don't, but they lower them if you do. So if someone joins a stop smoking program, if they join that program, they lower the premiums. Well, it turns out people join it, they stop smoking. They stop smoking, and all of a sudden they're not using inhalers. They're not going to the emergency room with asthma problems. Their children aren't either. And so they've been able to, whereas Medicaid and Medicare have had increasing cost, this Safeway's insurance costs have been flat. So by adjusting lifestyle, by incentivizing and empowering patients to make decisions that are good for themselves, employees to make decisions that are good for themselves, everybody wins. Now that's kind of a patient-centered approach. Many other things I can talk about that. But I'd rather at this point see what's on your mind and interact.